Diphenhydramine, also known as Siladryl, is an antihistamine that can help relieve symptoms of allergies, hay fever, and the common cold. These symptoms include rash, itching, watery eyes, and sneezing. It can also help with nausea, vomiting, and dizziness caused by motion sickness. Additionally, diphenhydramine can help you relax and fall asleep. This medication works by blocking certain natural substances in your body that cause allergic reactions and symptoms like watery eyes and a runny nose. It is important to note that cough and cold products have not been shown to be safe or effective in children younger than 6 years old, and some long-acting tablets/capsules are not recommended for use in children younger than 12 years old. It's crucial to follow the dosage directions carefully to decrease the risk of serious side effects. It's also important not to use this product to make a child sleepy or to give other cough and cold medications with similar ingredients. Always consult with your doctor or pharmacist for more details on using this product safely. Remember, these products do not cure or shorten the common cold, and may cause serious side effects. If you have any concerns or questions about relieving cough and cold symptoms, it's best to ask your doctor or pharmacist for alternative solutions such as drinking enough fluids, using a humidifier, or saline nose drop/spray. When taking Siladryl, it's important to follow the directions on the product package or as prescribed by your doctor. You can take the tablet, capsule, or liquid form with or without food, and be sure to measure the liquid form using a special measuring device. If you have a single-dose form, you do not need to measure the dose. The dosage will depend on your age, medical condition, and response to treatment. Different brands and forms of diphenhydramine are available, so be sure to read the dosing instructions carefully for each product. Do not increase your dose or take this medication more often than directed. If you're taking Siladryl for motion sickness, take your dose 30 minutes before starting activity such as travel. For sleep aid, take your dose about 30 minutes before bedtime. If you continue to have difficulty sleeping for longer than 2 weeks, contact your doctor. Remember to tell your doctor if your condition does not improve or if it worsens. If you experience drowsiness, dizziness, constipation, stomach upset, blurred vision, or dry mouth/nose/throat while taking Siladryl, let your doctor or pharmacist know. To relieve dry mouth, you can suck on sugarless hard candy or ice chips, chew sugarless gum, drink water, or use a saliva substitute. It's important to note that your doctor has prescribed this medication because they have determined that the benefit to you outweighs the risk of potential side effects. Many people using Siladryl do not experience serious side effects. However, you should contact your doctor right away if you experience any serious side effects, such as mental/mood changes, difficulty urinating, fast/irregular heartbeat, or seizures. Additionally, seek medical help immediately if you have symptoms of a serious allergic reaction, like rash, itching/swelling, severe dizziness, or trouble breathing. Keep in mind that this is not a complete list of possible side effects, so if you notice any other effects, be sure to contact your doctor or pharmacist for advice. Remember, it's always important to communicate any concerns or experiences with your healthcare provider. Before taking Siladryl, it's important to talk to your doctor or pharmacist about any allergies you may have. This medication can also interact with certain medical conditions, so be sure to discuss your medical history, especially if you have breathing problems, high pressure in the eye, heart problems, high blood pressure, liver disease, seizures, stomach/intestine problems, an overactive thyroid, or difficulty urinating. Siladryl can cause dizziness, drowsiness, or blurred vision, especially when combined with alcohol or marijuana. It's important to avoid driving, using machinery, or doing anything that requires alertness or clear vision until you can do so safely. You should also avoid alcoholic beverages while taking Siladryl. If you have diabetes, liver disease, phenylketonuria, or any other condition that requires you to limit or avoid sugar, aspartame, or alcohol, be sure to talk to your doctor or pharmacist about using this product safely. It's also important to note that children and older adults may be more sensitive to the side effects of Siladryl. In children, this medication can often cause excitement instead of drowsiness. And in older adults, it can lead to drowsiness, dizziness, confusion, constipation, or trouble urinating, which can increase the risk of falling. If you are pregnant or breastfeeding, be sure to discuss the risks and benefits of taking Siladryl with your doctor before using this medication. Siladryl may interact with other medications, which could affect how they work or increase the risk of serious side effects. Make sure to inform your doctor and pharmacist about all the products you are using, including prescription and non-prescription drugs, as well as herbal products. Some products that may interact with Siladryl include antihistamines applied to the skin, opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, and other antihistamines. Additionally, be cautious when taking other medicines, such as allergy or cough and cold products, as they may contain ingredients that cause drowsiness. It's important to consult with your pharmacist about using these products safely. Furthermore, Siladryl may interfere with certain lab tests, potentially causing false results. Therefore, it's essential to inform lab personnel and all your doctors that you are using this medication. If you or someone you know has taken too much Siladryl and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help by calling 911 or a poison control center. In the U.S., you can call 1-800-222-1222 for your local poison control center, and in Canada, you can call a provincial poison control center. Symptoms of overdose may include severe drowsiness, seizures, and widened pupils. In children, you may notice mental or mood changes such as restlessness, irritability, or hallucinations before drowsiness sets in. It's important to get medical help right away if you suspect an overdose. Make sure to keep all your scheduled medical and laboratory appointments. This will help ensure that you are using Siladryl properly and that it is working effectively for you. If you forget to take a dose of Siladryl, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next dose at the regular time. Don't take a double dose to make up for the missed one. Make sure to store Siladryl at room temperature and away from moisture and light. Don't freeze the liquid form and keep it out of reach of children and pets. When it's expired or no longer needed, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.